opportunity to share some of experiences regarding the principles and the practices regarding the Ayurvedic dermatology. Actually, this is a course which deals with the principles and practices of Ayurvedic dermatology, and mainly deals with the Kerala practices that we are doing presently, and this is the experiences happening during 15 years of my experiences in our government Ayurveda College, Kannur. During this period, I have seen or experienced so many dermatological cases, treatment, and I have collected so many documents, and I am trying to share these experiences with you. While we are practicing a specialty medicine, we should be able to explain the specific reasons for selecting accurate medicines for each and every clinical condition of skin. In OPD, many times PG students or students sitting around us will ask, why, sir, this particular kashaya you selected, or why this particular tablet you have selected, like that. Students will ask. So at that time, we should be able to explain the reason for selecting such a typical medicine for some specific cases. Secondly, we should be able to tell the precise diagnosis. Otherwise, we are not treating the patient systematically or scientifically. If we are giving a medicine in a dermatological case, we should be able to clearly explain the reasons, and you should be able to diagnose, or in our own terms, based upon our own principles, we should be able to explain the diagnostic principles and the precise diagnosis of the case. Other than that, for a particular case, if we are giving medicines, that case should be treated, or that should be healed better. Without excellent results, we should not be able to explain why we are giving these medicines and all. So we should get excellent results also. If we are not getting results, why we are not getting results, we should be able to explain. That is critical evaluation. We should be able to evaluate the case, whether the case is healing with our medicines or this is aggravating with our medicines. Why this is happening like that? We should be able to evaluate or critically comment upon the cases with our medicines. Other than that, each and every case should be documented properly for giving guidance to students or colleagues. In this type of cases, it should be it will be able, this particular type of medicine or this particular type of management is effective. Like that, we should guide the PG students or colleagues. For that, we should be able to document the cases ideally, and those cases documented properly, that should be presented acceptable in an acceptable mode before a scientific world. In a group discussion, we should be able to present our case with Ayurvedic profile and Ayurvedic treatment modalities. We should be able to present that case. Then only we will be a leading authenticity in our specialty field. Along with that, in every specialty, every particular field of Ayurveda, there will be some technical skills associated with it. Technical skills means, in the case of dermatology, we know there are so many Raktamoksha techniques. Other than that, there are so many bandaging techniques. There are so many washing techniques. So we should be able to explain, or we should be skilled in these techniques. We should be the leading authenticity in that particular field. Then you will be the icon in that specialty field. So I am trying to highlight these points with some Ayurvedic dermatological experiences with you. At the end of this discussion, this session, after 9 o'clock, you can ask the relevant questions related with this subject, and I will try to answer your questions, and like that way our discussion will be very fruitful, and that the field of Ayurvedic dermatology will be known to you, what we are practicing here in Kerala. That will be very, very effective in your clinical practice. First of all, I will be dealing with some 10 or 15 images or cases that we are regularly dealing with here in our OP. In our OPD, we are treating this type of cases regularly. You see, this is a palmar psoriasis case. This is a guttate psoriasis case. This is an infected eczema. This is a herpes lesion. This is a plantar psoriasis. This is a palmar psoriasis. This is a lichen planus healing phase. This is also eczema. This is a stasis eczema. This is also edema associated with stasis eczema. Lymphedema also is there. Also a stasis eczema. So psoriasis case. This is an ulcer, venous ulcer. So scalp psoriasis. Keratitis, hyperkeratitis of plantar region. Tinea cruris case. It's also a lichen planus is infected. Okay. Then, while dealing with the Ayurvedic dermatology, the 3 points we should be very, very particular. We should be able to diagnose the case exactly. The clinical diagnosis is very important, and appropriate internal medication we should be very thorough, and most suitable external therapy also. So these 3 points I will be highlighting during my session. How we should be well versed to diagnose the case very exactly in Ayurvedic parlance, or with the help of Ayurvedic basic principles, how we can diagnose a clinical case of dermatology, and how we can administer, or how we can try a correct internal medication, or how we can prescribe a scientific internal medication in the case of Ayurvedic dermatology, and more how we can prescribe, or how we can advise a most suitable external therapy. These 3 points are very, very important, and during this session I will be focusing mainly on 3 factors. So see, many of our doctors will be doing a practice with medicines prescribed or medicines advised by our clinical medical reps. They are advising us, sir, this is an amazing drug for psoriasis, or this is an amazing drug for lichen planus, like that. They are advising us, and we are blindly following their advices, and we are prescribing some medicines like that. So many qualified doctors also following this line of treatment. So this should not be a scientific treatment by our part. Some of practitioners will stick on the terminologies. Vicharchika, Sidmam, Megagustam, Mandalagushtam, Dadru, Shidavittam, Visapam. These are some terminologies described related with the cutaneous manifestations in Ayurveda. While we are discussing the skin diseases in Ayurveda, we can see discrete distributions in various parts of our textbooks. Vicharchika is there, Sidma is there, Yagapushta is there, Mandala. These are all the terminologies. So many of practitioners will try to diagnose the case with the names, whether this is Vicharchika or whether this is Sigma, whether this is Yagapushta, like that. While we examine the treatment part of our Chikitsa Prakarana in textbooks, we cannot see the treatment for Vicharchika, treatment for Sigma, treatment for Dadru, like that. So it is not that much important to identify the terminology of a particular case in front of you. Other than that, you see, Dosha dooshya assessment may be a very important tool for identifying or diagnosing a case. But you see, if you identify a Vadika Kushta with a dry lesion or a blackish lesion or a painful lesion, and you are prescribing a Vada antagonistic drug or Thaila or Grida, then next day or next week itself the aggravation happens. Skin lesion may get aggravated, infected dermatitis will be there. So weeping eczema may exacerbate. So Dosha dooshya assessment also has some limitations while discussing with the diagnostic aspect of Ayurveda. Other than that, in some cases you can see the investigations are very, very important. For example, in the case of repeated carbuncles or repeated nodules, pustules in our body may be related with the systemic the diabetes. As a part of a systemic disease, cutaneous manifestation may be there. For example, in PCOD case, there will be some hirsutism or the acanthamus nigricans lesions may be there. Any disturbance in my voice? Hello? Can you see? Can you hear?
No, sir.
Yes.
Sir, some persons are like adding up onto our session. In between that, noise is coming. Otherwise, we can continue, sir. No problem.
My voice is audible?
Yeah. Yes, sir. Definitely. It is clear.
Okay. Then
Okay.
may I continue?
Yes, sir. Thank you. Okay.
Okay. So in some cases, the investigations are very relevant because if we identify a particular case associated with a systemic illness, then the treatment for systemic disease is very important in order to alleviate the skin condition. So in some cases, investigations also have some relevance. So as you have seen, the related with diagnosis, the Dosha dooshya assessment or the terminology or the investigation are relevant up to some extent, but they are not the ultimate diagnostic tools. As far as Ayurveda is concerned, the diagnosis of an Ayurvedic the dermatological case or Ayurvedic the skin disease, the diagnosis of a skin disease has to be done with some other methods. Otherwise, the treatment will not be that much systematic or scientific. You see, in the case of skin diseases, every immediate presentation or every external morphological presentation, it is a manifestation or outburst of an inlaid pathology. Internally, there will be a huge pathology inside our body. The signal or iceberg symptoms are seen externally as eczema, psoriasis, or lichen planus. So, while seeing every skin diseases, you should have an inference or anumana that the patient is having a huge internal pathology inside his body, and the presentation or morphological lesion is a mild presentation of that huge pathology inside his body. This is the basic principle of Ayurveda while treating skin cases. You see, as far as Ayurveda is concerned, very clear descriptions regarding the Samprapti is described in Ayurveda. Without this Kshatriya Kala, there will not be any manifestations in our body other than the Agantu Vigaras. For every Nija Vigaras, there will be 6 steps: Sanjaya, Pragopa, Prasara, Sthana, Samsraya, Vyakti and Bheda. So, initially there happens a precipitation or Sanjaya, and that Sanjita Dosha Dushti or Sanjita Ama will be dislodged from the Koshta to the Shaka as a result of the Pragopa, Prasara, and that dislodged ama or dosha dushti will be accumulated or will be dislodged at the level of srodhas due to the sthana samsraya, and this sthana samsraya creates the Vyakti bhava of the skin disease. So you see, for every manifestation you should have an idea that this manifestation is a signal presentation or a mild external presentation of a huge pathology inside his body. So events in Samprapti, you see, there will be essentially, obviously there will be Prathilomatha inside his body, and Ama will be there, Agnimandya will be there, Dosha Gopa will be there, Dhadu Dushti will be there, Srodha Dushti and Krimi Janma. These are the essential events happened inside the body of a cutaneous manifestation. These may have different degrees in their severity, but essentially there will be the role of these factors inside his body. That is why we are telling that Samprapti Ghatakas are very important, or Samprapti Ghatakas has the principal role as far as diagnosis is concerned. So you see, in the case of modern medicine, they are having the reductionist principle, and the Ayurvedic people are having holistic principle. Reductionist principle says that the immediate presentation should be alleviated with a drug of steroid or antibiotic that will be subsided. In the case of Ayurveda, you see the immediate presentation is a result of the all happening inside his body. The Samprapti Ghatakas are disturbed very much. So we should be able to identify the Samprapti Ghatakas in detail. Otherwise, if we are giving a ointment or a simple medication externally or to subside the symptomatic manifestations, then that symptoms will be alleviated, and after 2 or 3 weeks that will reappear. That is very obvious. So it should be in Ayurveda, if you should treat the patient as a Shuddha Chikitsa, you should be able to identify the case in a holistic view. Then we should be able to see the patient or see the Samprapti Ghatakas or Samprapti of the patient with reference to the Anilomada, Amada, Agnimandya, Dosha Bruddhi, Dhadu Vaishamya. So these are the Samprapti Ghatakas, and for each and every patient, we should assess the patient with respect to the Anilomada, Ama, Agnimandya, Dosha Bruddhi, Dhadu Vaishamya, Srodha Dushi, like that. Then only we will be able to diagnose the case in Ayurvedic profile. Otherwise, we are treating the patient, we are not treating the patient, but we are treating Vijarchika or Signum with a stereotypic drug which are having some stereotypic effects. But after 2 or 3 weeks or 2 or 3 months, that will reappear with double force. So we should be able to identify the case with a reference to the Samprapti Ghatakas. Then you see, these are the then you will be having the question how we should be able to identify the Prathilomatha of the patient. Prathilomatha means from the costa, the Amasanjaya or Dosha Dushti is dislodged due to Prathilomatha. So we should be able to reverse the direction of Prathilomatha Vayu into Aniloma Gati. Then only the patient will be having the basic factors in a normal mode. So initially, in the case of that may be eczema or psoriasis or lichen planus, but we should be able to identify whether the patient is having Prathilomatha or Anilomatha. That is the first step. Whether he is having ama, whether he is having Agni-mandya, like that, we should be able to identify. Then we should be able to give drugs which can reverse the pathology. Samprapti Vigatanam Chikilsa. Samprapti Vigatanam Chikilsa and Nidana Parivarjanam Chikilsa. So, in the case of eczema or in the case of acne vulgaris or in the case of scalp psoriasis, whatever may be the case, you identify the status of Prathilomatha initially in the body. So, usually we will ask some questions, whether you are having constipation, whether you are having fullness of abdomen. If the patient is telling, my bowel motion is okay, I am not having fullness of abdomen, then we will consider patient is not having Prathilomatha. He is having Anilomatha. That is a wrong consideration. That is not the assessment of Prathilomatha. You see, Prathilomatha should be assessed with the help of Udavarta Prakarana. There are very clear references regarding that. Upper respiratory allergies will be there, headache will be there, heaviness in chest will be there, cough, stomachache, and constipation. Stomachache and constipation or heaviness of abdomen are mild symptoms. Major symptoms are upper respiratory allergies, headache, heaviness in chest, cough. If the patient is having these symptoms, initially we should be able to prescribe some medicines suitable to aniloma to reverse the Prathilomatha of Vayu. Otherwise, the basic generating house of the body, the basic generating force inside his body will remain there, and the ama or dosha dushti will dislodge constantly. Then, if we are prescribing Nimbadi Kashaya or Manjishtadi Kashaya or whatever be the drug prescribed in the case of Kushta, there are so many Kashayas and Hridas and tablets are there. That will symptomatically may give result. But the basic pathology of the body or basic pathology of cutaneous manifestation will not be reversed by our Ayurvedic medicines. For that, in order to reverse the basic pathology, we should be able to assess the Prathilomatha in his body, and we should be able to reverse the condition with the proper anilomana drugs. As anilomana drugs, I am just giving highlights to some basic principles and basic idea regarding this. After this, we will discuss some medicinal aspect after this. If we are only describing the medicinal aspect, then we will be having so many doubts regarding the basic principles. If I explain the basic principles, you can correctly correlate or correctly utilize the drugs you are having in your places. Otherwise, if we are I am telling some Chiruvilladi Kashaya or Abhaya Churna like that may not be available in your place, or some doubts may happen. Initially, if I explain the basic principles, then you may utilize the drugs suitable for the condition. So, Prathilomatha should be assessed properly initially. See, this is a case of chronic acne vulgaris. So, normally in the case of acne vulgaris, we will prescribe so many Manjishtadi Kashaya, Nimbadi Kashaya, Mahadiktayam Kashaya, Diktayam Kashaya, like that. So many Kashayas there are there. Detailed in the case of cutaneous manifestations in Ayurveda. So we will select some drugs from there. But if normally these patients, the patients of this age will be having the Prathilomatha essentially. I have experienced that the most probably 60 or 70% of achin vulgaris cases will be having strong Prathilomatha inside his body. So usually before giving specific medicines for the skin condition, here we are prescribing Chirulya Kashaya, Tribhara Churna, Abhaya Churna, like that. These Kashayas are very suitable to reverse the Prathiloma Avastha from the Koshta. In the case of females, we are giving Saptathara Kashaya, Aniloma as Anupana as Tribhara Churna, Gurgulu Panchavala Churna, we are adding. Saptathara Kashaya in male boys, we are giving Chirulyadi Kashaya added with the Tribhara Churna. So, the basic principle of that prescription is that this. We are giving a proper anilomina and a Klayada Hara. Anilomina and Klayada Hara are very relevant in these cases. See, this is the assessment criteria for Samatha inside his body. Whether the body, in case of skin diseases, Samatha is very, very important. Patients will be having Apajita dosha inside his body for chronic period. For long time, they will be having a samatva inside his body. Fullness of abdomen and raised body temperature, heaviness of body, acid belching, foul smelling, anorexia. These are the symptoms of ama inside his koshta, and the amatva inside his dhatu. Dhatu leenatva is very, very relevant. In the case of cutaneous manifestations, other than the koshta amavastha, rasa gada ama and rekta gada ama, mamsa gada ama, these are very, very important pathologies. So, the abdominal fullness, heaviness of body, acid belching, foul smelling, anorexia are the symptoms of samatva inside his koshta, while raised body temperature is an important criteria in the case of dhatu leenatva of ama. You see, while we are asking the patient, you should ask this question: whether you are having a slight increased temperature inside your body. That may be subjective, or sometimes the bystander, mother or father, they will tell, yes, doctor, we are while palpating his body, the temperature is somewhat aggravated, like that. The patient or bystander will complain. So you should be able to identify that samavastha inside his body. If that samavastha is latent or stagnant inside his body, it is not advisable to give medicines specific to psoriasis. We should be able to give Pajana drugs initially. After Pajana, Divana, we should be able to give specific medicines to Srodha and Dosha Shamana, Dhatu Prasadana, like that. Otherwise, directly if we are going for Srodha Shuddhi and Rasa Dhatu Prasadana or Rakta Dhatu Prasadana, if we are going for that, patient may have some symptomatic relief. After that, 2 or 3 weeks or 2 or 3 months, that will recur. So, the second thing, after Prathilomatha, the samatva inside his body should be able to identify properly. You see, this is a case of pemphigus vulgaris. This is you see the pemphigus cases. You see mainly many skin diseases, they will be having latent amatva inside his body. By seeing the external appearance, if we are giving a drug suitable for the dosha vriddhi or dhatu prasadana, then the chances of aggravation is very, very, very large. So you should be able to identify the latent pathology like the iceberg phenomena, the huge samprapti inside his body. You should be able to identify. So there should be there will be essentially there will be samatva inside his body. In those cases, we are giving amapajana drugs. Amapajana drugs, there are so many types of amapajana drugs available in Ayurveda. Koshtakada amapajana, Amrudottaram Kashayam is a very, very good choice. Shaddaranam Guliga or Shaddaranam tablet we are prescribing for Koshtakada ama. Rasagada ama we are prescribing Kalingagadi Kashayam. Described in Ashtangardam Hridayam Vishamajara. In Ashtangardam Vishamajara Prakarana, you can see Rasagada Amachigilsa, Rektagada Amachigilsa, Mamsagada Amachigilsa, like that. There are some specific medicines are there. I think you all got my the book regarding the Ayurvedic dermatology, consultations in Ayurvedic dermatology. I have described all these kashaya in that book. Vishamajra Prakarana in Ashtangardya, we can see the descriptions regarding the Kalingagam Badavalisya Patran Gadavironi and the Badavala Shariva Musta Pada Gadavironi, like that. Rekta Pajana Kashaya, Rasapajana drugs are the like that. So initially we should be able to prescribe the medicines which are giving proper amapajana at the level of koshta, rasa, rekta, like that. Essentially, there will be the amavastha inside their body. While describing in Padartha Vijnana, you will be remembering the quotation that yatra yatra dhuma tatra tatra vanni. Yatra yatra dhuma tatra tatra vanni. Where there is a presentation externally, there will be essentially, obviously, there will be internal pathology, very, very large internal pathology inside his body. Essentially, the ama is a very, very important factor in that body. So, amapajana drugs are very, very important. So, before giving an amapajana drug, you should not be motivated to give some srodha shuddhi or dosha shamana drugs. So, initially, we should be able to give proper anilomana drug or proper amapajana drugs. You see, in the case of amavastha, bahu doshavastha or amavastha inside his body, anilomana and sramsana drugs are very, very suitable management modalities. You see, so in the case of sramsana, we can see sramsanam aktavyam yad abaktu iva srishtam koshte maladigam. Aktavyam yad abaktu iva. Yes, whether there is a huge abundant dosha dushti or ama inside his body, it is advisable to give a drastic purgative drug or drastic sramsana drugs which can eliminate as much as possible ama from the koshta. Then we can give amapajana drugs in a very small dose. After removing the huge ama from the koshta, we can give a pajana drug for remaining ama. You see, regularly in Ayurvedic dermatology practice, we are giving sramsana drugs initially. Padola Muladi Kashaya or Padola Muladi Churna, like that. Manipatra Churna. These are drastic purgatives or drastic sramsana drugs. After giving a drastic purgative or after giving a sramsana, we are getting a result that the huge abundant ama or dosha dushti eliminated from the koshta. Then we can give amapajana drugs for remaining ama from in the body. You see, in the case of pemphigus vulgaris or exacerbated infected eczema, it is not suitable to prescribe the drastic purgative drugs. If we give a drastic purgative drug, there should be eliminated. They should be getting drastic purgation repeatedly, and that may aggravate the infection. So initially we should be able to give advise some amavaginal drugs only. Otherwise, the purgation may increase the vada gova, and that may aggravate the condition. So amavaginal drugs like Shatangam Kashayam, Nishundi Shadangam. Nishundi Shadangam means after avoiding the Shundi from the Shadanga Kashaya Toya, we are adding some this Amrita and Amrita Shadangam Kashaya. Like that, we are giving Pajana drugs suitable initially for Amavajana inside the body. After Amavajana only, we are switching on to other drugs.